Hi, my name is Kesha Engel. I'm here at the Infinity Healing Center, and today we're talking with Noushin, Izadi. And Noushin, you have a board certification in thermography.
Yes.
And your business is here at the center. It's called View of Health Thermography.
Yes.
Why don't you briefly explain to us what that's about?
Well, breast thermography is an imaging method where we use sophisticated infrared cameras and computer systems to capture the heat pattern from the body's skin. And those heat patterns then translate into some image readings that could indicate potentials for abnormalities in breast cancer. The way that it works with the heat pattern, it picks up a process called neoangiogenesis, which means new blood vessel formation. What that means is in the breast, when there are precancerous or cancerous cells that are growing and multiplying, they need and demand for blood flow to bring nutrition to them and take away the waste. And the way they do that is they grow blood vessels around themselves. And that generates heat, which breast thermography would pick that up and detect that heat as a way of potentially indicating a future risk of a breast cancer.
So it's a preventative process to understand the heat pattern in the breast.
Yes, understanding the heat pattern is early detection.
Right.
And also we have a preventative aspect of that, which works through the estrogen levels in the breast, because the number one cause of breast cancer is overexposure of our body and our breast to estrogen over the lifetime. And the heat patterns of overexposure to estrogen shows as a unique blood vessel pattern in both breasts that can then be indicative of a risk that a woman may have or be at a higher risk of a future cancer. And then the action we take at that point, if that is present, is to ask the individual to go back to their doctor to do further testing to really see if the estrogen levels are at an abnormal level. And if positive, then their appropriate treatment would be done by their doctor, and therefore in that sense it also becomes a preventive way through the those blood vessels that are abnormal, which can be picked up many years earlier.
Many years earlier than?
Then they could turn into cells that would be cancerous.
Okay.
It's about 8 to 10 years before a mass can be detected on a mammogram.
Oh, that's the key question.
The heat patterns would have an indication that something might be happening, some cell activity is going on, and that then translates into early detection. And as we know, and research has shown the past 30 years, that the key to early detection is being able to catch it really early, in very early stages. And 95% cure rate is possible once it's caught at a very early stage.
Okay.
And that's where thermography helps by indicating that there might be a future risk of breast cancer, so the individual can be monitored more closely, and or if it is present, then it would also show.
So that was certainly my experience. I had been very religious about getting mammograms for many years, thinking I was doing the right thing. And when they discovered the cancer, they had told me that it had been in my system for many years.
Yes.
So I wish I would have known about thermography sooner.
Absolutely.
It's been around a long
Absolutely.
time.
Yes, it's actually been around in the digital infrared form since 1980s, and FDA has approved it for being an adjunctive technology to mammogram. So mammogram and thermogram, they're like apples and oranges. They're not really comparable. Thermography is a physiological examination that looks at the functional aspects of the breast, such as the heat patterns that would indicate future risk. A mammogram is a structural examination, which potentially looks for a mass after it's been formed.
After it's been growing for many, many years.
True.
Yeah.
So one of the really amazing facts about thermography is that during the 8 to 10 years that a typical cancer takes for it to be detected in a mammogram, because it needs to become about a centimeter in size for it to be picked up by the mammogram. So during that 8 to 10 years, the early detection results or translates into 95% cure rate.
There you go. Okay. So when would you recommend people getting it? I know mammograms are usually recommended at age 40. How often should a person come in for a thermogram?
Well, what we recommend is the first baseline to be done at age 20.
20, young.
And then every 3 years until the age 30. And then after age 30, about once a year.
Okay.
In that way, basically, thermography could be used for women of all ages, for breast health care. Below age 40, there is no real protocol right now that I know for mammograms. And also there is the density of the breast that makes it harder to read in a mammogram.
Right.
And so that's kind of an area where with a thermogram, the density of the breast or implants or size of the breast, it really doesn't matter. It can read the heat pattern no matter what the age is or how much the density or size or even implants. So
that could be helpful. I know in my case, my doctor was interested in reading the thermography results that I had with you in order to go any further with the testing for a mammogram and to compare that before doing an ultrasound. So I've learned this as I go along. So, so it's an adjunctive kind of treatment.
Yes, absolutely. So it doesn't, mammography and thermography, like I said, are like apples and oranges. One is the functional and physiological, which is thermography, and the other is structural. So they complement each other.
Right.
They don't replace each other.
Yeah. So you recommend people have it at about age 20. Do you do other kinds of testing with this thermography? Can you pick up other kinds of cancers, like with a body scan, or?
For the breast cancer, it's the most well-known and popular form of use of thermography. However, there are many indications of use that FDA has approved our thermography equipment to be used for musculoskeletal situations or conditions that people may have, and many others. So we do a full body scan or regions of interest, as people might be interested in pain management. A lot of chiropractors and acupuncturists, they look at these images to see where the root cause of the issues might be as they're working on their patients. Thyroid issues are really popular that people could pick it up really quickly on a thermogram, and it's very easy. A lot of women like to do it as they're doing their breast because it's right there and they're already acclimated, so they just look at their thyroids as well.
Okay.
Stroke prevention, it shows indications if the blood vessels are not normal in the brain, and when we do a face and a head and on the side. So many different applications. Fibromyalgia is another indication of use that people have used it for, which are usually difficult to be picked up with other tests.
Okay.
And some chronic inflammations that people have, again, difficult to pick up with other tests. So yeah, there's many other uses, but we focus a lot on the breast thermography because this is like such a fact that 1 out of 8 women will have breast cancer.
Yeah.
And having this technology out here to prevent a future risk.
Absolutely.
That is an amazing thing, and that's the message that I really want all women to get, that they can do something about it. They can take an action now.
So how do people go, what is the fee? How does it compare to a fee with a mammogram? I'm sure there's a cost to this.
It's an economical way of doing the breast health care. It probably equates to the copay that a lot of people pay for a mammogram.
Okay.
So it's cheaper than a mammogram, definitely.
Okay.
On average, it costs about $250 for a breast thermogram, or an upper body, or a lower body.
Okay.
So
and this is covered by a cash payment or credit cards or?
Yes, usually people pay whichever method of payment they like. If they wish to submit to their insurance, we also provide them with a letter of necessity.
Oh, okay, great.
For medical necessity.
That was a great question I was going to ask next.
Yes.
So in some cases,
depending on the insurance. I know Medicaid doesn't cover thermography yet.
Okay.
But as we get more into the preventive ways of taking care of our health, it might. But at this point, I know Medicaid doesn't cover.
Well, there's so much that's changing in healthcare, and to be preventative and to know ahead of time can save thousands of dollars in the long term. So,
and people's health, which is the most important thing.
Right. So can you tell us a little bit about your background, Noushin, and how you came about this and what your credentialing process is?
I'm a board-certified thermographic technician in clinical thermography. And I also have been trained through the International Academy of Certified Thermographers. I also work with a board-certified thermographer, DC, who has been in thermography field.
DC, that is?
Doctor of Chiropractic.
Okay.
So a interpreter of a thermogram should be a licensed diagnostician, and like a DC or an MD or a DO, and in addition to that, be board certified as a thermographer. Okay. And there's also strict protocols that we follow for the equipment that we have, which is FDA approved, and as far as resolution and accuracy, as being the top of the marketplace right now. And also for the patient and the laboratory protocols, those are the strict protocols we follow, which are standards through the International Academy. And those standards had been set in the 1980s. Okay. And also for interpretation, there are very strict protocols that the interpreters have to follow. Wonderful. Our system is an open system, which means that the interpreting doctors are not tied to the camera manufacturers. So the patient could potentially bring their images to any board-certified thermographer who interprets of their choosing. So that's kind of another thing that differentiates us from other centers where the interpreting physicians may work very closely with the camera manufacturer. And that is a closed system. So we offer an open system here.
Very interesting. Okay,
Yeah.
great. Good to know. And I know that the FDA regulates mammography equipment, and there's strict protocol there. So it's good to know that very similar standards are set
Yes.
for our own sense of safety with this process.
Oh, absolutely. Yeah, FDA approved thermography as adjunctive technology in 1982. So this technology has been around for some time, and now that we have all the sophisticated digital technology, it really makes it a lot more worthwhile to focus on. A little bit more about my own background.
Yes.
I came to thermography after about 10 years being in the healthcare medical environment, working with various medical technologies, and decided that this was a very non-invasive, radiation-free way to monitor breast health, as well as help in many other areas and conditions with, like we talked about earlier, chronic issues that people have with pain, inflammation. A lot of times people are told this is the way it is, just kind of live with it. But as we know, the root cause of a lot of these issues may not be where it hurts, and that's what this technology can help. So that's
Very good.
how I'm here.
Yes, excellent. I appreciate you sharing with this information. It's really been helpful for my life, and I trust that as the word continues, that it will be helpful for your life too. So thank you, people, for watching, and
Thank you.
make an appointment with Noushin.